Absolutely. That's what I wanted to ask you, like a Heidi Montag. She became a poster child for getting so much surgery done and at one time, and I know you did this show, Extreme Makeover,
yes,
where you did that on a lot of patients. You really gave them a complete makeover, top to bottom, right?
Yes,
you didn't just
very
do one
often.
procedure. Yes,
Correct.
very often. So how did that make you feel? Do you think that's the right decision? Do you think it's individual? Do you think those people are, is it something missing inside, or do you think that does shift them?
Well, I don't know Heidi Montag.
Because she said she regrets it.
Yes.
Yeah.
When I heard all of the procedures she had done in one session, a red flag, a warning sign went up. I knew there was something wrong in the decision-making process. Now, Extreme Makeover was somewhat similar in that we were offering individuals who would never have the opportunity to have a lot of things done for free. And so it's hard for a patient to go, you know, I'll just think about having my nose done, but let's not worry about the liposuction. They're going to be inclined to go, give me as much for free as I can possibly get. So it becomes the surgeon's responsibility to make sure that it's safe, because after hours and hours of surgery, even on a healthy individual, the risks go up. So I'm proud to say that I talked to the producer at the time, who was very understanding. I said, look, we're going to have a misfortune unless we are willing to offer these patients 2 surgical procedures separated by a couple of few weeks. And he was very responsive and receptive to that, because safety is a primary issue. So I don't think we were dealing with people with body dysmorphic disorder. We were dealing with people who would never have an opportunity to get their teeth fixed and to have their eyes look better.
I watched a couple of the episodes, and it was very inspiring, actually, and I was like, oh, I didn't expect this.
Yeah, there were a lot of pleasant surprises, I have to say.
And they seemed really like normal people who just said, I don't look the way I feel inside, and I just want my inner to match my outer.
That's a typical complaint, especially as people age. They go, I feel like I felt when I was 30 years old, but I look like I'm 65, and it doesn't sit well with me, and maybe I could do better at work, or do better socially, or just feel more confident in myself if I looked younger and looked better. Those are good candidates for plastic surgery. And many people, I still recall sitting in the preoperative room preparing to mark a patient for surgery, and have the woman in this particular case, who remains a friend of mine, say, you know, I've waited 31 years for this procedure. In her case, it was a breast lift and a breast augmentation. When you think about a 16-year-old feeling poorly about their body shape and image, how it affects them and how it affected their life and their self-confidence, and in the course of 2 or 3 hours to be able to dramatically change that, it's a very powerful tool.
Absolutely.
So it has to be applied selectively and carefully. And you know, sometimes we make